So now that we've talked about the extraction process used to create medical marijuana products, now let's talk about how we can use medical marijuana most effectively. At Iona Cannabis Clinic, we like to say, one part is greater than the whole. 1 + 1 = 5. Wait, so the math isn't adding up for you? Well, we believe it's important to use CBD and THC together whenever possible to create a synergy effect. This means a ratio of 1:1 of CBD to THC tends to work best. When you use CBD oil, you can think of it as an antidote to THC since they both compete for the same receptors. That means if for whatever reason you may have taken too much THC and feel a high of sorts, you can counter that with CBD to kind of bring you back to normal there. This is why we are big proponents of microdosing. Instead of vaporizing when you may feel the need to relieve symptoms, microdosing takes a more proactive approach by intaking smaller amounts of medical cannabis products more frequently throughout the day without getting high. Microdosing tends to affect the whole body instead of going straight to your head, causing a more pronounced psychoactive effect. For patients that are new to medical marijuana, we introduce the treatment plan slowly, and the best way to do this is through oral products. Taking medicine orally will allow the benefits to last longer, up to 2 to 6 hours, compared to inhalation methods like vaporization that don't last as long. We have a number of microdosing plans customized for each patient's conditions. For example, if you suffer from pain, we recommend taking oral doses 2 to 3 times per day because it will last longer and provide a better pain management plan. However, for patients suffering from anxiety or depression, it may be a once-a-day dosing. So how do we start microdosing treatment plans? Well, it all starts with the stock of the chicken soup, our friend CBD. So in the case of our depression patient, we will recommend the following dosing schedule. Now, days 1 through 3, we're going to start off with 5 milligrams of CBD 2 times per day, taking orally around 8 a.m. and 2 p.m. Now, day 4 through 6, we're going to stick with the same CBD schedule and amount, but now introduce a THC product which will be dependent upon the patient's symptoms or conditions. The amount of THC will be 1 milligram taken orally at the same time as the CBD, 8 a.m. and 2 p.m. Days 7 through 9, we stick with the same CBD dosing regimen, but now we up the THC to 2 milligrams, sticking with the same dosing schedule of 8 a.m. and 2 p.m. Days 10 through 12, the pattern continues as we stick with the same dosing schedule for CBD and THC, but now we increase the THC to 3 milligrams. And days 13 through 15, you guessed it, same old thing, but now we up the THC to 4 milligrams, and then days 16 through 19, same routine, except we add another milligram of THC to get you up to the 5 milligrams. So now at this stage, we're taking 5 milligrams of CBD and 5 milligrams of THC to create that 1:1 ratio, 1 + 1 = 5. See, now the math does add up. What is the point of all this? The point is to get you to reach the point of cannabliss. What is cannabliss? That's that effect of 1:1 ratio of 5 milligrams each of CBD and THC. It should really start to alleviate things like pain, seizures, and muscle spasms. Now, please note, this is a recommended microdosing schedule based on a hypothetical patient. This may not be the perfect regimen for you. We ask that all patients please monitor the effects of their microdosing schedule, and if for whatever reason you do feel an intoxicating effect, just scale back the THC dose. And that should take care of it. Thank you for choosing Iona Cannabis Clinic. We look forward to serving you.